thing that comes once a year that everyone gathers around to make game day snacks, wear their favorite jerseys, bet money, and drink alcohol is the Super Bowl. Who doesn't love a good championship NFL game? Currently, in the United States, there are approximately 1.5 million young people participating in organized football leagues. Countless of that 1.5 million people are injured from the sport of football. Today, I will explain how football is a dangerous sport because it causes many short-term injuries, long-term damages to the body and brain, and increases use of performance-enhancing drugs. Playing football causes many short-term injuries. Playing football causes many MCL sprains. The medial collateral ligament is a strong ligament located on the inside portion of the knee. It is made up of two bands and connects the femur and the tibia bones. The primary job of this ligament is to prevent side-to-side motion of the knee, along with the lateral collateral ligament and other structures. This is the most common knee injury in football players at the high school, collegiate, and professional level, typically an offensive and defensive lineman. Depending on the severity of the sprain, you can be out anywhere from several weeks to 2 months whenever symptoms improve. Some of these sprains even result in surgery to fix. Playing football also causes meniscus tears. The meniscus is a crescent-shaped piece of cartilage located between the tibia and femur bones. There are two crescents, one on the inside and one on the outside of the joint. These are common injuries in the general population and are very common in football players. These injuries typically occur when the knee is flexed and twisted, which puts the greatest amount of stress on the meniscus. Treatment is based on symptoms, but often includes surgery. Following surgery, players can gradually return to play when symptoms improve, usually after 3 to 4 weeks. Lastly, playing football causes ACL tears. The ACL is the most important structure preventing the tibia bone from moving too forward of the femur bone. ACL tears are the most common major knee injury to occur in football. These ruptures are the result of both contact and non-contact injuries. Running backs and linebackers are the highest risk positions. When a player tears their ACL, they are most likely out for the season. That's because ACL tears are usually reconstructed with surgery, and the rehab from these surgeries is lengthy. Returning to play takes anywhere from 6 to 9 months, sometimes up to a full year. Now that I've explained the short-term injuries as a result of playing football, I will tell you the long-term effects. A long-term effect of playing football is concussions. Concussions occur when a collision causes the brain to hit the inside of the skull. The greater the force of the impact, the more severe the concussion. Symptoms can include disorientation, memory problems, headaches, fogginess, and loss of consciousness. After suffering from one concussion, a person is much more likely to suffer from a second one after another injury. The CDC reports that having more than one concussion can cause depression, anxiety, aggression, personality changes, and an increased risk of Alzheimer's, Parkinson's, CTE, and other brain disorders. For the time period of 2012 to 2019, the NFL injury data shows that an average of 242 NFL players per year sustained concussions. Another long-term effect of playing football is CTE. CTE is a brain disorder that is caused by repeated head injuries. These brain changes progress and worsen over time and may not be noticed for months, years, or decades after the last brain injury. One famous example of CTE is former NFL star Aaron Hernandez. Hernandez committed suicide in prison where he was serving time for murder. The autopsy results revealed that he had a severe case of CTE, the worst case ever reported on such a young man. Hernandez was diagnosed with stage 3 CTE, which causes memory loss, damaged thinking, as well as changes in behavior and impaired judgment. Lastly, playing football can cause sleep apnea, diabetes, and heart problems. Players who are encouraged to remain large for their position or players who cannot lose weight once they retire are at serious risk for sleep apnea. Similarly, the consequences of obesity, such as diabetes, may affect heavier football players long after they retire. These players are also at risk for cardiovascular disease, high cholesterol, and high blood pressure. Now that I have explained both the short-term and long-term injuries and effects of playing football, I will now explain the increased use of performance-enhancing drugs. Marijuana has been responsible for more drug suspensions than any other PED in the NFL. Players use marijuana as an addictive painkiller to help cope with the injuries of the sport. Of all the stimulants and used in the NFL, Adderall is the most historically abused by defensive backs. Players addictively use Adderall to stimulate the central nervous system to release neurotransmitters like dopamine. Almost 60% of the suspensions amongst linemen are attributed to steroid use. Players abuse steroids because it increases their size and strength and often makes users more aggressive. Lastly, HGH, also known as human growth hormone, started getting tested in 2014 for football players. Players abuse this drug because it boosts strength and speed in the short term, and long term it says it helps lean body mass. In conclusion, football is a dangerous sport because it causes short-term injuries like MCL sprains, meniscus tears, and ACL tears. It also causes long-term effects like concussions, CTE, sleep apnea, diabetes, and heart conditions. And lastly, it increases drug abuse. Therefore, I come to you today to raise your awareness of how dangerous the sport of football is.